While aromatherapy has many different scents, each having its own benefits, today we will be specifically discussing peppermint oil and its abilities and benefits to the digestive system. Peppermint oil is made from the essential oils of peppermint leaves, and it is known for treating various conditions, including irritable bowel syndrome, nausea, and other digestive issues. Peppermint oil can also be applied as a topical ointment for relieving headaches, itching, and muscle pain. Think back to the last time you had an upset stomach. Have you ever reached for one of those pinwheel peppermint hard candies during that time? I know I have, and while it may not have subsided all symptoms to an upset stomach, it certainly gave some relief by coating my stomach and taking away any unwanted nausea feelings. Now, think back to the last time you had intense muscle aches and pains in either your neck, shoulders, back, or maybe even all of the above. A topical ointment such as Icy Hot can treat minor aches and pains by providing temporary relief by stimulating the nerves near your skin, blocking those pain signals. Lastly, think about the last time you had intense reactions to mosquito bites, eczema, poison oak, or even poison ivy. There are other peppermint topical ointments out there that can relieve any burning, itching sensations. Overall, here are just a few of examples of how peppermint can help to take away any unwanted, uncomfortable feelings.
Symptoms of IBS may include gas, bloating, abdominal pain, constipation, and diarrhea. It can be very uncomfortable, and the peppermint may help. Human studies suggest it can lessen abdominal pain and other symptoms of IBS. It appears to activate a specific anti-pain process in the gut and dull pain-sensing nerve fibers. One study had people take an enteric-coated, sustained-release peppermint oil before all meals for 4 weeks or take a placebo. The supplement produced a significant reduction in IBS symptoms compared with the placebo. So if you suffer from IBS, try a cup of mint tea. If it's not enough, discuss a peppermint supplement with your doctor or dietitian. It may increase your heartburn or interact with some medications. With Food for Thought, I'm Nancy Dell.
I had always loved bath bombs growing up. At one point, my parents had gotten me a kit to make my own. I figured, since I often got sinus infections and spent most of my time congested, that I would use peppermint oil in my bath bomb. I figured it would open me up and help me breathe. So I mixed my ingredients together and got ready to add the drops. I certainly added way too much, and then we had to open all the windows in the house. It definitely cleared everybody out. Then, I also remember when I was about 15, my dad started to have really bad stomach issues. They were awful and nothing we could do would help him. He went to the doctor countless times, and none of them could figure out what was wrong with him. After months of being in pain, my mother began to conduct some research in order to figure out how to ease his pain. She saw an article that said adding peppermint oil to tea would help coat the stomach and relieve my dad's discomfort. After adding 2 drops to his tea, my dad started to feel the relief. Although it can be used for many ailments, peppermint oil is most effective when treating stomach issues or IBS. Pseudoscience is the assemblage of ideas that are often mistaken as being proven by the scientific method. The question we must ask ourselves when analyzing whether or not the claim of peppermint oil is the most effective in treating IBS must be, is this claim based on science or pseudoscience? The claim is in fact science. We know this because the claim has gone through several different studies proving the statement to be true. A telltale sign of pseudoscience is the inability to reproduce findings. For example, one study was conducted to see if peppermint capsules were effective in treating IBS. It is noted that the medical interventions are scarce for this condition, and they are focused on controlling the symptoms of irritable bowel syndrome. The study was a randomized, placebo-controlled study. After the original study, the researchers conducted 8 other studies to make sure they could prove their findings. After the 9th study, researchers concluded that the peppermint oil was more helpful to patients than the placebo. The study deemed that peppermint oil is a safe short-term treatment for IBS. The second study was a 4-week randomized, double-blind, placebo-controlled clinical trial. It was conducted at 4 different facilities around the U.S. and was able to reproduce the results at each site. The second study also concluded that peppermint oil was a safe and fast remedy for IBS symptoms. The third study analyzed 12 randomized clinical trials. The point of this study was a meta-analysis in which they looked at studies from all over the world to compare findings. Meta-analyses are important because they provide side-by-side comparison of findings within each study. 7 of the studies reported that the oil helped with improvement of IBS symptoms. 6 studies also reported that the treatment overall improved stomach discomfort. All the studies were able to produce the same findings, in which that peppermint oil is an effective way to lessen the symptoms of IBS. Another characteristic of pseudoscience is the absence of peer review. The first 2 articles were actually mentioned in the meta-analysis. If the claim was pseudoscience, it would not have been reviewed or included in a larger scale study. Lastly, when reading the articles, they do not promise the impossible. Promising the impossible is a pseudoscience red flag. The studies all say that using peppermint oil can relieve discomfort, rather than saying it will cure the patient's IBS. To figure out if the claims are plausible, we asked ourselves 2 different questions. How does the claim work, and does the explanation make sense based on what science knows? The claim is said to have worked by ingesting the oil. It can be taken in something, by itself in liquid form, or within a capsule. It is inferred that once taken, the oil will move throughout the digestive tract with antimicrobial, anti-inflammatory, antioxidant, immunomodulating, and its anesthetic properties. Peppermint oil works by coating the small intestine. It contains something that works as an antispasmodic, therefore relaxing the smooth muscles in the intestine. Peppermint oil is a natural plant that contains compounds that target the pathophysiology of IBS. Therefore, based on what science knows, the claim is in fact plausible.
As mentioned from the very beginning of our presentation, starting with our introduction, we know that peppermint can treat various conditions in 2 forms, the essential oil and the topical ointment. When used as an essential oil, peppermint can help irritable bowel syndrome, nausea, and other digestive issues. And when used as a topical ointment, it can relieve headaches, itching, and muscle pain. While our thesis does state that peppermint is used as a remedy for many ailments, as I just mentioned the most common, it is most effective when treating irritable bowel syndrome. But how do we know that it is most effective? Or how do we know that it is effective at all? We know this because of the scientific evidence. that proves this statement to be true, and we found this evidence as we researched information for our citations. Starting with our first citation from PubMed.com. Peppermint oil for the treatment of irritable bowel syndrome, a systematic review and meta-analysis. The purpose of this study was to assess the efficiency and safety of coated peppermint oil capsules, compared with the placebo for the treatment of irritable bowel syndrome. The study lasted for 2 weeks, and a total of 9 studies were performed. 726 patients were involved, and overall, peppermint oil turned out to be superior to the placebo. What stood out to me the most in this particular study was the conclusion, as it states how peppermint oil is a short-term treatment for irritable bowel syndrome. This study further goes on to suggest that future studies should assess the long-term efficiency and safety of peppermint oil. I strongly agree because while a quick fix may seem like the best option, it is important to know longer-term effects to ensure that recurring issues are not happening. The next study also comes from PubMed.com. A novel delivery system of peppermint oil is an effective theory for irritable bowel syndrome. This particular study lasted 4 weeks, and there were 72 patients involved. 35 received the peppermint oil, and 37 received the placebo. After 4 weeks, the peppermint oil had 40% reduction with irritable bowel syndrome, whereas the placebo had a 23% reduction. Overall, patients with the peppermint oil experienced greater improvement in many gastrointestinal symptoms, as well as severe symptoms compared to the placebo. And just like the first study stated, peppermint oil is both a safe and effective treatment, providing fast relief to irritable bowel syndrome. Lastly, the impact of peppermint oil on the irritable bowel syndrome, a meta-analysis of the pooled clinical data. This study included 253 patients receiving the peppermint oil and 254 receiving the placebo. The confidence interval was 95%, and this tells you the stable establishment. A stable estimate is one that would be close to the value if repeated again. For global system improvement, the ratio was 253 to 254 regarding abdominal pain. The RR from 6 randomized test control with peppermint oil was 278 versus the placebo of 273 was 1.78. There were no differences in adverse effects. Peppermint oil had 32 events, 344 total, 9.3%, and the placebo had 20 events, 327 total, 6.1%. The number needed to treat with peppermint oil to prevent one patient from having persistent symptoms was 3 for global and 4 for abdominal pain. Overall, based on these 3 studies, it is clear that peppermint oil is successful rate higher than the placebo, and it is safe and effective treatment for irritable bowel syndrome. In conclusion, we can now say that we have learned that our thesis statement was in fact correct and proven accurate. While peppermint oil is used as a remedy for many ailments, as we've mentioned the most common throughout the course of this PowerPoint, irritable bowel syndrome stands out above all other conditions due to it being scientifically proven to be the most effective. With that being said, consider peppermint to be your go-to product the next time you have an upset stomach, nausea, or any other signs and symptoms of irritable bowel syndrome. Whether these symptoms are minor or more serious, peppermint is proven to give relief. Even if it's minimum, I think it's safe to say that some relief is better than no relief at all.